G'day, it's Paul Bergamo from NeuroLogic Education, and I'm here with my good friends Dr. Nick Gentile. G'day, Nick.
How you going?
And Dr. Marcus Yeo.
Hey, how you going, Paul?
Now, I'm feeling odd because I'm the one who doesn't have a hat, but that's okay. Is that all right, guys, if we just do a quick little interview here without the hat?
Yeah, go for
You
it.
can't all be as cool as us.
Exactly. I'm trying. I'm still got a long way to go. Now, Nick, firstly, so how many years in practice?
6 this year.
Okay. And Marcus?
This is my 11th.
11th year. Okay, so we've got a nice spectrum of two recent sort of graduates, although Marcus, over a decade now.
A few greys getting in
You're
there,
starting
that's
to...
why we're wearing
Oh, right.
Yeah.
The head's a coverage thing, I get you, no problems at all. So, firstly, Nick, what have you picked up from the seminar?
Really, really great info, especially on falls prevention. I've got a practice with quite a big geriatric population.
Okay.
So just the morbidity for that and the kind of risk factors that you can bring into that.
Okay,
So,
fantastic. Excellent. And Marcus?
Yeah, well, I really like the laser, headwear that we got to do as a really objective measurement to, understand how well we are tracking as well, because, I use some of these balance assessments and things like that in practice, but to have something objective like that, and then also as a rehabilitative tool is really fantastic as well. So I grabbed a few of those and the charts as well, which you can use to retrain, which is great.
And they look really cool as well, the lasers on your head.
right.
They look really awesome.
Just the look as well.
Yeah.
Yeah, exactly. Well, there's got different functions on that you could use.
Yeah, I'll use it when I go camping.
Yeah.
Different components. Now, the other part too is that, we did a lot of assessment things. We did some joint position sensing. We did 2-point discrimination. And they're things that perhaps we learned at RMIT that we just sort of decided whether it's either pass or fail. But we now have taught today that we get, and in the last day and a half, that we can actually use that as management as well. But it doesn't work well.
Yeah.
We can use it as a management tool. Any thoughts on that, guys?
Yeah, well, at RMIT often it's taught more just about pathology, but to learn it in a functional way is really great, and to have it as part of an overall assessment to look at the neurological function of our clients or patients, it's really handy actually. Yeah.
Fantastic. And final question, guys. Monday morning is tomorrow. So what are you going to start to look to bring into practice? Because that's really important. As you know, I've talked about that in the integration component just then. What are you going to try and bring into practice as soon as possible?
I reckon the fall screening straight away.
Yep.
Yeah, especially even with younger people, not necessarily just geriatrics, but people who, have had some sporting injuries or young kids, things like that, just to give them a really good kind of guide of how the neurology is tracking. But certainly with older people, definitely straight away.
Fantastic. And Marcus?
Yeah, well, I'm probably going to go away and try and reassess a few of my systems and procedures, even my history form, ask some different questions up front, and then also look at, integrating falls prevention toolkit as well, because that was a really, really simple way at analysing something that's, such a profound impact on our society. So.
Fantastic. Thanks, Marcus.
No worries.
Thanks, Nick.
My pleasure.
We look forward to catching up with you at our next NeuroLogic Education event.